Dignitaries, Dr. Reddy, ladies and gentlemen, this is a tremendous privilege and a great pleasure to be with you. As a Brit, I always love coming to India anyway, so this is a wonderful excuse and a great chance to meet some old friends and to talk about a subject that I'm passionate about, which is health. Dr. Reddy, I salute your great and noble ambition of health for everyone in the country. This is a fantastic journey that you and everyone in this grand coalition, am I speaking? Oh, I'm being given a lozenge. This is proper healthcare in action. Sorry, was I not speaking loudly enough? Can people hear me okay now? Yeah, very good. Well, as I was saying, it's a terrific privilege to be here. Can I say that I used to be in government, but I'm not in government, so I'm not speaking for the British government. Having said all that, I do know that we have these great links between our country and your country, and I do know that there is a continuing relationship around health, which our Department for International Development will want to continue, but so I know will also our NHS. So I hope that you will hear and develop, as you develop your role and your work here, that you look upon the Brits as friends who will be wanting to come and join you, and also to learn from you, because I am a very strong believer in the fact that you are doing things that we can learn from, and hopefully we've done a few things you can learn from. And the sort of motto that I tend to use is everyone's got something to teach and everyone's got something to learn. And I think that's probably the sort of motto of this conference, in a way, by bringing every one together. Now, I was asked to say something, excuse me, from my experience of the two roles that I played in the United Kingdom. I was Chief Executive of the National Health Service, so that's the biggest health organisation in the world, with 1.4 million employees. I'm always told that there are three bigger organisations in the world, and it's the Chinese Red Army, and then it's the Indian Railways, and then it's Walmart in America, and then it's the NHS in England. Am I told. So I was chief executive of that, and I had the privilege of trying to lead that organisation to make change. But I was also the permanent secretary, as we call them, so the head of the Department of Health. So I was also responsible for policy. So what I'm going to do is just say a couple of things from both of those perspectives about what I've observed in the UK, what I've observed in India, but also a bit about what I've observed around the world, because I occupied those roles between 2000 and 2006, and more recently I've been working in low and middle income countries, with the biggest emphasis actually on Africa, working there mainly, though a little bit in India. And I should say that I'm chairman of Sight Savers, who have worked here in India since 1964. So I'm going to mention 5 big points of policy, and then I'm going to pick up 3 issues around service and where I think the biggest gains are going to be made in the short term in service delivery. So the 5 big points in policy, some of which I think have already been touched on by Srinath Reddy. The first point is that health is cultural. It's about culture and it's about values. In the UK and Europe, we have this strong sense of social solidarity, about it all being in it together, about having tax-funded systems. You may know that in the United Kingdom, we don't have a constitution. There's no national constitution. But there is now an NHS constitution. We have an NHS constitution that sets out rights and responsibilities, what people can expect, and it's based on a set of values. And I think that's really important. We see health as a public good, not as a private good. Now, there are other countries around the world, and most notably, of course, the United States, who have a different model and a different culture, and they see it very differently from the way that we do in Europe. I guess that you're probably a bit nearer to us, but maybe you're partway in both areas, with your mission to provide healthcare for everybody. I just want to stress that for us, it is about values and about culture. It's about a grand coalition. It's about getting people together. It's about doing the deals. It's about working together. But it is about vision and values. And we in the NHS have survived now for 65 years. And the reason we've survived is those shared vision and those shared values. I guess there are people in this room who've worked in the NHS. We are grateful to the many doctors and nurses and others of Indian origin who have supported us in the NHS. Can I say that from my former role? But you will know that we've had some really tough times, and it's that shared vision and those shared values, and I congratulate you very much for this bringing together of people, and indeed for the point that I think you're creating a Senate, you're trying to bring people around, and I'll be very interested in these 2 days to hear how you're going to build that and develop that sense of being in this together. The second big point I'd take from the NHS is that the private and the public sector both have very significant roles. When the NHS was founded, it was public sector, public money and public service. Now it is public money and it is private or public providers. And there are two very distinct sets of roles that we have got and that we have paid attention to. We see the role of government as being very much about setting the framework, about maintaining those values, setting the vision, doing the regulation where you need to have regulation, and remembering that regulation can be disenabling as well as enabling, and bringing people together. And we see the private sector increasingly taking on a role in delivery, and with their ability to innovate probably quicker than you get in the public sector. So there's a wonderful partnership that is being forged here, I think, in India through this and through other means. But both parts are very vital. And in the government space, I would say amongst the things that we have done well in the UK are the evaluation of health technologies and the assessment of therapies and treatments. We've got a fairly controversial organisation called NICE, the National Institute of Clinical Excellence, which is controversial because it assesses some drugs, some controversial drugs. It's only assessed 100. It doesn't look at other therapies. It looks at other therapies that we want it to look at. And it runs something called NHS evidence, which is the continuous supply of NHS evidence, the best up-to-date evidence to clinicians throughout the country. And that is so valuable. And it seems to me that in your country, this must be one of the big issues for you, about how you spread knowledge, about what works. And you have this fantastic, innovative private sector. And you know as well as I do, and I'm not making a particular big point here, that some of the things that are being developed will work wonderfully, and some won't. And somehow you've got to sort that out. And if you're spending a lot of money, and I was spending $175 billion a year in the NHS, we needed a mechanism to sort out which were the ones we should bet on and really go for, and which were the ones which actually weren't successful. And I guess it's the normal bell curve distribution, isn't it? With 10% fantastic, 10% pretty troublesome, and a lot in the middle. So I do think there's a serious role, a significant role for the assessment of technology, and something that government has to sponsor as being not part of the system. Third point, which Srinath Reddy has already mentioned, is that health is, of course, about society, and it's about having pro-health policies, as you said, I think, Srinath, in every other part of society. We haven't been as good at that in the NHS as we should have been. We haven't made sure we got into the schools and worked with the children. We haven't made sure we've got into industry and worked with employers. We need to do more of that. We use the label of health in all policies. We expect, and this is a European thing, not just a British thing, we expect that actually health needs to feature in all public policies, whether it's food or whether it's employment or whether it's education, if you're really going to make a change. My fourth area is that I do hope, I've seen a lot of India. I've seen India in eye care because of Sightsavers having been here for a long time and being partners with Aravind and others since the 60s. But I've seen a lot of other very innovative things, and you will all probably know that at the great gatherings of the great or the good around the world, places like Davos and so on, you get the examples of the Indian entrepreneurs who are shaking things up and moving things on. And that's fantastic. And I do think that's wonderful. And I would urge you to continue to be obsessive about quality. Continue to be obsessive about making sure that what you're doing is what works. And that actually it's high quality. I know this is a particular concern and passion for Apollo, because I've spoken to Dr. Reddy and colleagues about that before. But this point about quality improvement is really important, and I think it should be a mainstream of your policy. And let me just deal with one thing that some people may think. Quality, of course, doesn't cost money. Quality normally saves money. Waste costs money. Quality is about eliminating waste, doing it right, and doing it effectively. Quality does cost money if you add additional things. But in your system, and I've seen it, and in my system, we have got a lot of waste. So an obsession with quality would be my fourth point. And my fifth point, and it shouldn't be my fifth, is of course build on that wonderful Indian history I've just talked about. Somebody gave me a figure somewhere, you might be able to confirm, that it's either a third or a quarter of doctors in the world are of Indian origin. It's some phenomenally large number. And if you go to the United States, you'll see that, even more than if you go to the United Kingdom. You know, you've got this fantastic tradition of medicine in the world. You've got these fantastic examples, which we've just touched on, in innovation in all kinds of ways. And you've got some great stuff that I know the government has been doing around the rural mission and the urban mission, and indeed many, many local projects. We have, as I said earlier, a huge amount to learn. So for me, this is a question of respectful co-development. We can learn from you and you can learn from us. So my 5 policy points are the first one about health being cultural. And what are the values this is based on? Do you need some kind of constitution? Do you need some kind of statement? Maybe you have one of what the vision and the values are that people can unite around. The second one about getting the right relationship between the private and the public sector, and perhaps having some kind of concordat even around that. The third one is this health in all policies that I talk about. The fourth one is be obsessive about quality. And the fifth one is build on what you do, and you do it very well. And we can learn from you as well as the other way around. Let me just finish with my 3 very quick points about services. That was all the policy side of the job, if you like. Thinking about services, my observation around the world is there are 3 things that are coming together. I call them the triple gain, and they're the ones that are really making change happen. The first one tends to get called in America, where I was just very recently, yesterday, patient activation. You know, patients doing stuff for themselves, people doing stuff for themselves, we doing stuff for ourselves. Anyone with diabetes knows that you do a lot of self-care. But there are some remarkable examples. Wonderful one in Sweden that I came across recently, where patients do renal dialysis for themselves in the hospital. Renal dialysis is very debilitating. I've never had it, but I understand it's very debilitating. If you need to do it 3 days a week, then it's a real problem. But this is a hospital in the centre of Sweden where if you're a patient, you can learn how to do it for yourself, and you're given a swipe card. And you go into the hospital and you swipe in at midnight or 3 in the morning or whatever time suits you, and you hook yourself up. Not only is it better quality because there's no risk of cross-infection, it's also cheaper. Some extraordinary developments happening around patient care. The second one is health workers' roles. We in the West in particular have got some very traditional demarcations between doctors and nurses and others. Those are shifting. You've shown how to shift them. And it's really important to do that shifting in a practical and flexible way. And the language I use for that is making sure that everyone working in health is working at the top of their license. So you don't have doctors doing stuff that other people can reasonably do if they're properly trained. And you don't have nurses doing stuff that other people. You should be working at the top of your license. You have this great scarcity of staff. So I would put that very high on the list. And the fourth bit is, of course, the bit you know probably better than I do, is about science and technology coming together and leveraging this. So patients doing more, staff changing their roles and developing, and science and technology shifting it. Let me finish with one story from the United Kingdom, which is the biggest single randomized controlled trial on remote monitoring of patients. Happened about 3 years ago, was reported in the BMJ of a year and a half ago, July 2012, if you want to look at it. 6,000 patients, 3,000 in the trial, 3,000 control, completely randomized. They weren't patients, they were members of the population actually, so they weren't chosen patients, a randomized part of the population. 3,000 of them were given the entitlement of accessing services remotely. They were monitored remotely. If they needed access to services, they could ring up, they could do everything remotely. The other people used the NHS in the normal way, which means you have to go there. Fascinating trial. It brings together my 3 points. It brings together patients doing something differently, because of course if you're monitoring yourself and accessing, you have to do something. You're not a passive patient. The second area it brings is, of course, big change for staff. You know, and you can imagine some people who've worked in traditional ways didn't actually really like the notion that the patient can get hold of you that easily. And the third thing, of course, technology. And the results, very simple. The trial group, something like 25% less use of resources, less admissions to hospital, less use of services. But the bit that surprised everyone was 40% less mortality. Maybe that's obvious. If you're monitoring people, maybe you pick things up earlier and maybe you reduce mortality. But isn't that an extraordinary story? And it seems to me it epitomizes the point I make that in service delivery, and I think a lot of your Indian organizations do this, the bringing together of patients, citizens, us, doing things differently and looking after our own health, staff doing things differently, health workers operating differently, and the wonders of science and technology, because it's also biomedicine and not just IT, because actually remote monitoring and so on requires developments in biomedicine as well. Those three things coming together are really important. So my final words are to wish you every success with what you're doing here. Very honoured to be allowed to come and join you and to be part of it and to join you later on today in a session around human resources. Love to stay in touch. But the final thing I want to say is I use the motto that I always use earlier of everyone's got something to teach and everyone's got something to learn. But I think it's more than that here. If you can really galvanize your great country or a significant part of your great country to provide healthcare for the citizens of your great country, then you'll be leading the world. You'll be showing us all something to do. So this is not just for your citizens. Can I say your efforts will be valued by citizens everywhere in the world. Thank you very much.